All right, welcome everyone to another virtual shadowing session at Hearts for Health. Today, we're honored to be joined by Dr. Kaplan, who is a practicing pediatric dentist in New York City and the recipient of accolades, including the prestigious American Academy of Pediatric Dentistry Predoctoral Student Award. This is one of our very first dentistry sessions, and we're excited to be introducing this new field onto shadowing. As a quick few reminders to those who might be new to shadowing in general, we have a Q&A saved towards the end of this session for the last 15 to 20 minutes. So if you have any questions, please type them in the chat box, and we'll be able to cover them at the end of this session during the Q&A. Dr. Kaplan will be able to go through those questions and provide some answers. Also, for those who want to stay updated with future shadowing sessions, we are now on a schedule of Mondays and Thursdays, mainly at 7 p.m. Central. There's sometimes sessions that go outside of that. The majority of them are on those days, though, Mondays and Thursdays at 7 p.m. Central. And to stay updated with them, you can either follow us on Instagram, where we post the flyers to these sessions, or you can join our listserv, where we also send out the flyers to these shadowing sessions and also include other program announcements. Outside of shadowing, we do have a few other programs. So if you're interested, you can stay tuned either way. For now, I think that's all. Also, one more thing, for those who want to join the listserv, in order to do that, you can either subscribe on our website. At the very bottom, there's a subscription form. Put your name, your email, and then send it off. You'll be able to receive those weekly listserv emails, or you can just email us directly and we can add you on from there. Our email is shadowing.h4h@gmail.com, and that 4 is a number. That's all that I have to say about reminders. And with that said, Dr. Kaplan, feel free to take it away.
All right, thank you for the introduction. I am Jessica Kaplan. I'm a pediatric dentist, and I'm happy to be here today to share whatever I can with you guys. I know you're mostly in college, so remember it's a stressful time trying to figure out how to get organized and prepped for dental school and everything after that. So what I'll talk about today is school, because that's obviously very important, how I got into dental school, what I looked for in a dental school, and same with residency, well, how I picked a residency, why I picked pediatric dentistry, different types of jobs that there are, as a pediatric dentist, what a day in the life is like, and I'll give you guys a clinical case as well at the end. So before dental school, I went to Emory University. I definitely did not know I wanted to be a dentist right away. I definitely had an idea, though, that I wanted to work with kids. That was always something I kind of had in the back of my mind. And I thought I would just do medical school just because it seemed like natural at that point for me. But I definitely wasn't sold on it. And so it took me a little bit of time to figure it out. And in the meantime, I decided to major in neuroscience and behavioral biology because I figured I'll just get all my pre-med requirements in either way and then kind of go from there. So sophomore year, I figured it out. Someone actually just gave me the idea, why don't you be a dentist? And I was like, oh my God, I don't know why. I never thought about that. That's a great idea. So once I figured that out, I tried to zone in on like whatever requirements I needed and get organized. There were definitely a couple funny things like taking an art class that I hadn't planned to do. But I figured all that out once, you look into what you need to do to get into dental school. And because I was taking pre-med classes or pre-dental classes, I couldn't do a semester abroad. So I did 2 summers abroad, which I definitely would recommend for anyone who's doing like the lab sciences during the year and you feel like you can't go abroad, go for a summer. It was a great experience, nothing to do with dentistry or anything that I do now, but I had a great time and really enjoyed it. And, you can still do fun things even if you're taking hard science classes. And then another thing that you have to do to get into dental school while you're in college or, doing post-bac, whatever it is you have to definitely shadow. I know things are very virtual now, so hopefully this will count as one of your hours. And then if not, you'll find another way to get them done. But I remember I shadowed probably about like 100 hours or more in a dental office throughout winter break. It's like when you have a month off in college, it's like a great time to get that done. And then junior year, I took the DAT, I did my dental school applications, and right after that, I went for a volunteer trip to Honduras for the first time. And I thought that was an amazing experience getting to go to another country and like get to travel because I love to travel anyway, and then also get to give back and be a part of something bigger was great too. So I would definitely recommend any volunteer trip that you can do while you're in college. It's something nice to talk about on your interviews, and dental schools usually look favorably upon that. So while I was also in college, the summer between junior year and senior year, I had nothing left to do because I'd finished all my requirements. I sent in my my DAT was done, everything was done, and so sent an application. So I figured, let me find something that's like kind of related to dentistry. I can maybe pad my resume a little bit, but like still, be relevant in dentistry and find something to do. So I was just literally looking on Google and I just researched like New York dental school volunteer department because I loved volunteering and I figured this is a great way to maybe get involved and like get one foot into a dental school. And I ended up getting on the phone with someone at the global volunteer department at NYU and the global outreach department. And I worked for them basically for free, just kind of as like an office assistant. So like photocopying papers or like help coordinating travel or literally anything that I could do to help, I did to help, which was amazing because I got to be in the dental school for a month. So I got to interact with dental students and faculty and kind of get to know people and see what went into making a global outreach. And then also over that summer, I did a 2-week program at UMDNJ, which is Rutgers now. I forget what they go by right now, but one of the two. It's called Gateway to Dentistry. That's a great program too. If you're interested in dental school and you're in college, they take you in for like 2 weeks to the dental school and you have these like very long days where you're side by side with dental students and you have lectures and labs and you just get to kind of get a little bit of taste of dental school. So that was great. And then I went back to college for senior year, back down to Atlanta and went on a couple interviews and saw some dental schools. And I kind of knew I wanted to be back in New York. I'm from New Jersey originally. So I wanted to be back up in the Northeast. And so I wanted a dental school so that had a lot of clinical experience very early on. And because I had an idea that I wanted to do pediatrics, I wanted to make sure I would get a lot of experience in the specialty clinics and that there were opportunities for me to spend more time there too. So that kind of led me into NYU. I mean, I'd spent the summer, interning there anyway, so it just felt like a natural fit. So the summer after I graduated from Emory, before starting dental school at NYU, I did something that they call the D0 research program. So you're not really a D1, which is a first year dental student. They call you a D0, so you're like nothing. But it's a program where you actually get credit in dental school. So like your research counts for research and credits. And they help walk you through doing a research program, which is great. And that's something that I didn't even know at the time, but found out later that residency programs really like to see also that you do research in dental school. So I kind of fulfilled that really easily without meaning to. And I got to spend the summer again in the global outreach department. And then they took me on an outreach trip with them too that summer, which was great. So in all, I got to go on a couple outreaches in dental school, which is something that I loved and have a passion for. And unfortunately with COVID, haven't had the chance to go on one recently, but hopefully can do one again soon. So with NYU, I traveled to Grenada, Poughkeepsie locally, because there's also always need in our local communities for dental care, Nicaragua and Nepal, and then again, Poughkeepsie when I was in residency, I went back with them too. So while you're on these trips, you still have to be respectful in the sense that like you're not a licensed dentist when you're in dental school. So you're working under the supervision of a faculty, but you kind of get like more leeway in the sense of like patients aren't coming in for a 2-hour cleaning appointment. They're coming in pain and you have to really take care of them right away. And so you kind of get to skip all the like annoying parts of clinic, which is like the intake forms and getting swipes and approvals and things like that. So it's a great way to work on your clinical skills, still take great care of patients, and provide a service that's needed in the community and travel. So while I was in dental school, some, things that I thought were really valuable were just the fact that NYU was so big because I got to meet so many different people from all sorts of different places and with all sorts of different jobs with faculty and, make great connections. So like, for example, now I still call some of my faculty even years later for advice. And so, I think making as many friends as possible, not just with your classmates, with your faculty and whoever else is working in the building, doesn't matter what they do, it's really valuable. And, different clubs and student council, whatever you can join to meet people is great. Going on outreach trips, like I love those. And I shadowed a lot in the pediatric clinic as well, which was important to me so I could get into a pediatric residency program. And a lot of dental schools have this, but NYU had an honors program in pediatrics. So it's something that you apply to while you're in dental school, I think in like your second or third year, and then you spend extra time your fourth year in that specialty clinic that you do the honors program in. So towards the end of dental school, I then got everything organized, applied to residency programs, and I wanted to stay in New York again. So just within New York, there are a lot of options, which was great. But there's a lot of variety amongst the different programs. So there's hospital-based programs where you just work out of a hospital, similar to like a medical resident, like they just work out of hospitals. And then there's school-based programs. So like, you could work just out of a dental school. And then there's hybrid programs where you work out of both. So NYU had a program that was hybrid. So you're based in a dental school and in a hospital. So you're based out of Bellevue Hospital, which is like a part of NYU, and then in the dental school in their post-grad clinic. So that was really appealing to me because I felt like I would get really good, I'd have great resources like to study for the boards and, kind of not be like in a super fast-paced hospital environment every day, but sometimes I was, sometimes I wasn't, and still be able to take advantage of like all the amazing connections of being a part of the NYU organization. So I matched into residency for another 2 years at NYU, which was great. And I loved residency. I found it to be way less stressful than dental school. Dental school, you're constantly like, so you have someone looking over your shoulder all the time. You have to coordinate your own patients. You have to schedule everything yourself. You have to really, really be on top of your requirements and make sure you're getting the patients that you need to graduate and like the credits you need to graduate. Whereas residency, you just kind of like show up, you see your patients, you go to the clinic, you go to whatever course or class you have, and then you go home and that's it. Like there's like little things that you have to do, but nothing of the magnitude of dental school was. I found it to be way easier and like way more fun. So I did have to do a research project again in residency, which everybody has to do. So it's not a big deal. They all kind of walk you through it versus in dental school, like no one's telling you that you have to do a research project. Nobody's telling you how to do it or who to talk to do it. You have to figure it out on your own. So residency is like way more of like a team environment in that sense. They did require us to, there's 2 parts to be board certified in pediatric dentistry. So they did require us to take the written part in order to graduate our second year. So they help you study for that, which was great. And then, yeah, you just have some like clinical requirements and cases that you have to have organized, but they, kind of remind you as like time goes on to stay on top of that, which is good. So once I graduated from residency, I was ready to go out and work. So before I could do that, I had to go look for jobs and find somewhere that was looking to hire a pediatric dentist. And I think in my head, I had this misconception that like I would just walk out my front door and start working. And that's not at all how it works. It takes a while to really find the right job. And interviewing takes a while too. So a lot of people start that process like while they're in residency, just making connections and looking to see what's out there. And I did a little bit of that, but New York is an interesting state with like licensing and things. So it takes a while. So you have a lot of downtime in between residency and working if you go straight through like I did. So I had a lot of time over the summer to take care of this. But basically, I worked 2 part-time jobs initially, which is very common for dentists to work a couple jobs during the week. So I worked initially 2 to 3 times a week in a Medicaid-based pediatric dental office. So what that kind of means, a very high level, is just that it's a lot of volume, a lot of kids, and very low reimbursement. So Medicaid is state insurance. So you can just imagine they pay less per procedure. So like a cleaning, for example, Medicaid will pay like a quarter of the price of what private insurance would pay, or maybe what you would get in a fee-for-service office. So your schedule is really busy, but you also learn things like efficiency and like how to streamline, different processes in an office. You have more support staff, so you're able to reach that volume. And unfortunately, most of the kids that are under Medicaid and in these offices are low socioeconomic status. So they do have a very high caries risk. So very often they come in with mouth full of cavities. And so you're very busy doing a lot of dentistry, like operative work. So like crowns and fillings and extractions. And then I also work 2 times a week in a multi-specialty office. So we have a endodontist, which specializes in root canals, a prosthodontist, which specializes in like big cases like crowns and bridges and implants, dentures. And then we have an oral surgeon and an orthodontist, which specializes in like braces, and then myself. So it's like a boutique fee-for-service PPO office. So it's a higher reimbursement, meaning, like I said, like a cleaning, you'll get paid 4 times more than you would in a Medicaid office. So you can then see a less volume of patients. So you're seeing like, 10 patients a day, whereas in a Medicaid office, you might see 30 patients a day. And then because it's a higher socioeconomic status population, the kids are at a lower caries risk. So less fillings, less extractions, less of that sort of stuff. So, there's pros and cons of both. I think you kind of see what works for you and like what you enjoy more once you're in it. And then you can kind of figure out where you want to go from there. So I'm glad I saw both ends of the spectrum. And I ended up, dropping the Medicaid office that I was working in and just picking up more days in my multi-specialty office. So I now work there 4 days a week, and I love it. And I'm very happy there, and I think it's great. But it's important to kind of see it all. Sorry. So what does work look like for a pediatric dentist? Like I said, 4 days a week, and oftentimes dentists work Saturdays. It's not uncommon at all. I was working 1 Saturday a month at one point. I've stopped since, but it is common. So like I said, I'm in a very high socioeconomic status population, and so it's a very low caries risk. So it's a lot of recalls and new patient exams, and we spend a lot of time going over their history, their habits, like these kids, depending on the age, they suck their thumb, use a pacifier, you drink from bottles or straw cups or open cups, grind, snore, nail biting, all those things we talk about. We talk about their home care, how they're brushing their teeth. I want to know who's brushing with them, how many times a day, what kind of toothpaste they're using. Are they flossing? Are they using mouthwash? Are they using an electric toothbrush? Every little detail I want to know about. And same with their diet. I want to know about everything. What types of snacks they're eating, what types of carbohydrates they're eating. Does it have fiber in it? Is it, processed snacks or fresh snacks like smoothies or juice? Like I want to know every detail. We give a lot as pediatric dentists. We spend a lot of time talking about anticipatory guidance. So, your kid is now 1. What are you going to expect within the next 6 months to know about, their oral health, and like, what can we guide you on? So, okay, they're 1, maybe they have this many teeth. They're going to have this many more in the next few months. And then by the time they're 2.5, they'll have all 20 or something like that. We have a lot of those types of conversations. And then we also spend a lot of time showing parents like how to brush their kids' teeth or how to take care of them, and what they can do at home, or what we talk about what they're doing at home and how they can make it better. We do a lot of preventative treatment. So what I mean by that is we don't want anyone to get a cavity. So something called sealants is a great treatment. It protects the permanent molars from getting cavities. It seals over the grooves of the teeth. So we do those on almost every kid when they get their permanent molars at 6. We have something called silver diamine fluoride, which is a very highly concentrated liquid fluoride treatment that we paint onto cavities. So we're not drilling, we're not numbing, we're not doing anything. It's literally just a paint, and it stops the cavity from growing. So we do that a lot. It's great. The only downside is it does turn the tooth completely black wherever the cavity is. So if kids have cavities on their front teeth, a lot of times parents are hesitant to do that treatment. But it's great for young kids if they're very high risk and we're just trying to stop the disease from growing. It's a great option. And then fluoride varnish too. We give kids every 6 months usually, or more often if they need it. So operative treatment, crowns, fillings, things like that. And then all sorts of behavior management is really important as a pediatric dentist. So things like, getting a patient comfortable in the chair, you have to know how to do. And then we also use pharmacologic behavior management. So we use nitrous oxide a lot, which is a gas that helps the kids relax. And then if they need it, we do have the option to give kids general anesthesia with a pediatric anesthesiologist who comes into our office, and they'll sedate the kid, and then we do all their dental treatment. So everything from x-rays and a cleaning to crowns and fillings and extractions. And then when kids turn 7, we usually screen them for orthodontics. So we work with an orthodontist very closely, and our orthodontist does treatment on our kids kind of like side by side in the office with us, which is great. And then before they're at that age, if they do need any sort of space management, I take care of that for them. And then as far as other sedations go, in residency, you're trained as a pediatric dentist to do oral sedation, but sometimes depending on the area that you work in, it's more popular or less popular. In New York, it's very uncommon for pediatric dentists to provide oral sedation. So I don't do it, but I know some who do, and I'm trained in it. So maybe if I move, I'll do it, but not today. We also treat special needs patients of all ages. So like even adults. So a lot of times what happens is they'll come in as kids, and we're trained to treat them as kids, of course, but then as they grow older, the parents or their caregivers are way more comfortable keeping them with the same office and dentist and, everything, just to keep, because they know it works. So we end up treating some of those adults. And, it's all like, it's not one size fits all with special needs or kids in general. Even we come up with custom treatment plans to make sure they're staying disease free, and we're getting them as much preventative care as possible. And then sometimes what we'll do is we'll have them sedated once every couple years in order to do any dentistry that needs to get done. And then, we always work with different specialists because I'm in an office with them. It's really easy, but very often pediatric dentists work alongside orthodontists, and then sometimes oral surgeons. We refer out wisdom teeth, supernumerary teeth, all sorts of things with the oral surgeon. And then as a pediatric dentist, I get to still do local outreaches, which is great, but it's a little different. I'm not going and doing dentistry. I'm just kind of going and visiting classrooms and teaching kids about oral health and getting to know the community, which is always fun. And then we also treat emergencies. So, every day it's something different. Usually there's like a thing where when it rains, it pours. So like I'll go a week where I'm constantly getting a 2-year-old who fell at home and like broke a tooth. And then I'll go a week where I'm constantly getting kids who have large facial swellings, but we treat everything. And we always take care of the kids in our office, no matter what they need. So this is a case that I'm going to walk you guys through. This is a patient that I had in residency. I'll try and explain it as best as I can, but if you have any questions at the end, feel free to ask. So this was a 5.5-year-old child. He came into the clinic with his mother and his older brother for just a recall exam. This was the first time I saw him. And whenever we see patients, we always check their chief complaint. So like, why are you here? What can we do for you today? And they were here for a checkup. And then sometimes they might come in and say like, oh, I've been having pains. And we get, the backstory, like the who, what, where, when, why, all of that. And then we go through their medical history, if they're on any medications, allergies, or their vaccinations up to date, have they been hospitalized ever? And then their risk, their ASA status, so like their anesthesia risk. For pediatric patients, we always go over their birth history. There's very often things that can happen when kids are born preterm and they're in the NICU and they're intubated that can then affect their teeth. So it's really important for us to have those puzzle pieces to put together if we have to. We go over their social history, which is really important as pediatric dentists. So like, who do you live at home with? We need to know who the caregivers are, who we expect to come to appointments with the kid. It's a legal issue. So it's really important we have that information on file. We need to know what language they're speaking at home. And socioeconomic status does indicate caries risk. So that's important for us too. Because once we know their caries risk, whether it's low, moderate, or high, we can then help customize their treatment plan and find out what they need and how we can treat it. And then their dental history. So have they been seen here before, or where have they been? If not here, do they show up to appointments? Do they cancel appointments? And how have visits gone in the past? Are they well behaved? Are they not well behaved? Are they just very young or, anxious, nervous, all that. And then we also want to know, like I mentioned before, like, are they brushing? How many times a day? Who is it with what kind of toothpaste? So this patient, you can see on the slide and you can read through very basic, he's brushing twice a day, fluoride toothpaste, but like maybe not a great diet, a lot of sugary snacks and beverages, and not flossing or using mouthwash. And habits, like I mentioned earlier, we always talk about habits. So this kid had a tongue thrusting habit, which you'll be able to see in the photos, kind of what that looks like. So these are his extraoral photos. It's always fun getting photos of a 5-year-old. It's not that easy to do, but he sat pretty well in the chair. His at-rest face was a little hard to capture, but I think he did pretty well. And then these are some intraoral photos from the first time I saw him. So you can see, like here, for example, even though he doesn't have his front teeth yet, his permanent teeth, right here, there's kind of like a space, like the teeth aren't overlapping at all, whereas they are here, which is like what we want to see. You can see it here too. This primary lateral incisor is not overlapping the primary lower lateral incisor here. So he does probably have some sort of open bite, even though we don't see his permanent incisors here. It's obvious. And these bulges right here, this is where his permanent central incisors are about to break through the gingiva. So from like initial look, here, nothing too significant. He maybe has like a little bit of demineralization here, like early stages of a cavity, but it actually looks like he's brushing his teeth pretty well. There's not a lot of plaque on them, maybe like a teeny bit here, but his tissue looks healthy really for the most part. Here's more intraoral photos, but unfortunately here you do see some cavities. So this is a cavity right here. This, when you check it with an instrument, you'll be able to feel that it's a cavity. These are his permanent molars, just starting to erupt here, here, and this one is mostly in. That is also a cavity. And then this, when you check it with an Explorer, you would feel that it's a cavity. So whenever we do an exam, whether it's a new patient checkup or a recall, we always start with the extraoral findings. So any asymmetry, have they had any history of trauma? What's their growth profile? So like when you turn to the side and look like this, is it convex, concave, flat? Anything like that, we start from the outside and work our way in. So everything looked pretty normal on the outside for him. And then we go to the intraoral findings. So we look at soft tissue, his tonsils, his airway, his gingiva, and then we get to the hard tissue. So his teeth. So like right now he's in early mixed dentition. We classify his occlusion. So back here, you can see where his molars are. We classify that where his canines are on the right and left, and any spacing or cross bites we always discuss, and then his open bite is noted too. And then once we go through that, then we get very specific with the dental findings. So we chart, if he has decay anywhere, or early cavities anywhere, any teeth that are partially erupted or missing is important to note. So we go through all that, and then we take x-rays. And then on the x-rays, you can see these are the permanent molars that are just starting to grow in. These are his baby teeth. This is a cavity right here. This is an early cavity. Same with right here, that's an early cavity. And then sometimes you can see cavities that are on the biting surface of teeth on x-rays, not always, but you can just see just barely right there, but you still have to correlate it clinically with the findings. So then once we get the radiographs, we do radiographic findings. So same way that we do the intraoral findings, we do radiographic findings, and then we put everything together, and we come up with a diagnosis or problem list and how we're going to treat it. So his chief complaint was that he wanted a checkup, so we have to make sure we address that. So we obviously take care of his checkup, but then we also let him know that he has cavities and what we're going to do about them. We review his diet because that was a problem. We go over that. And then, in the past, he's had a lot of failed appointments. So, we want to make sure he's going to come back, and we schedule like right then and there for his next visit, and make sure the parent makes a note of the appointment, everything we can do to ensure that they're going to return. He does have nice, healthy tissue. So that's good, but we want to make sure he's flossing, using a mouthwash if he's able to spit it, if rinse and spit. He's 5.5, is a little young, but some kids can. And then his dental diagnosis that he has caries. So we're going to come up with a plan on how to treat them. And then as far as a space analysis at 5.5, usually they don't need to see an orthodontist yet. If he needs a habit appliance, we can make that for him as pediatric dentists. And then sometimes what we'll do is we'll just wait for them to get a little bit older, and then we'll work with the orthodontist, and then they can just go through all of that treatment sort of at once versus twice. But that just depends on a conversation with the parent and the orthodontist and what works best for the family. So my treatment plan for this kid was to put a silver crown on one of his baby molars, and 3 white fillings, and then to put sealants on his permanent molars once they're fully erupted. And then we recommended this child to have nitrous oxide during all the treatment, just to help make it easier for him and try and get as much done as possible in that visit. So we took care of everything. He followed up a while later. You can see now he's got some front teeth coming in, which is great. So these are his central incisors that were missing in the original picture. This is the silver crown I put on his baby tooth. And you can see he lost a tooth here. And then on the bottom, and you can't even see the white fillings that we did. They blend in with the teeth nicely. So that's great. You can actually see the filling a little bit right here. But you can see he's still a mixed dentition. His tissue looks good. And he looks like he's flossing now, which is great. And you can really appreciate his open bite here. So his top teeth and his bottom teeth, they've got like a couple millimeters of space here. So it's definitely time for him to either work with an orthodontist or myself to help close that space. And then around this point in his development, it's normal for us to take what we call a panoramic x-ray. So this gives us a view of his maxilla and mandible, and we can see all his permanent teeth that are developing in addition to the primary teeth that you see in his mouth. So up here, you can see these are his second permanent molars, which come in around 12. These are his first permanent molars that he has in his mouth. That's the silver crown that we did. And then these are more permanent teeth getting ready to come in, and everything looks like it's in a great spot. We really just have to close the gap between his top teeth and his bottom teeth. Oftentimes we'll take this sort of x-ray on kids in mixed dentition and we'll see things like these canines being like totally in the wrong spot, or, you know, coming down in the wrong direction, and we have to intervene early to correct those sorts of problems. And then these are his x-rays that we took at his recall. So what's really great to see is he had some very small cavities and they haven't grown at all. Like this one looks about the same as it did on the original x-rays. And all the work that we did looks intact, which is great. So no new cavities is always great to see. So what's next? He needs sealants on his molars and maybe work with an orthodontist to correct his habit and close his open bite. So my favorite part about being a pediatric dentist is I love first visits. I love when little babies come in. Usually we recommend kids come in at 1. So we see kids at 1 and then we see them again in 6 months. They're still usually very fearful and very anxious and they cry. But then by the 3rd visit, they're great. So if you have kids, bring them in to see your pediatric dentist at 1. It's a lot of fun. I love it. We spend a lot of time talking to parents. And yeah, that's it. If you have any questions, we can take them now, or you can email me, reach out to me on Instagram. I'm available however.
First of all, thank you so much again, Dr. Kaplan, for taking some time to join us on this Monday evening and discuss a little more about pediatric dentistry. We do have a few questions, and you have touched on them already in your presentation. So if there's anything you want to add on to it outside of what you already mentioned, feel free. The first one is about approaching patients, especially given that these are pediatric patients. How do you go about that outside of what I know you've already mentioned?
I think if you're going into pediatrics, you have to like kids. And so approaching the kids kind of comes naturally because you like them and you want to spend time with them. For me, it was never something I had to think about, like how to approach a kid. You just are kind, calm, friendly. And, there's different techniques based on their age or their development, like what works best for them to be comfortable. You make sure you have a warm, welcoming environment. We have TVs on our ceilings in the office. Not every office has that, but, it makes it fun for the kids. They get to walk in and pick out what movie they want to watch. We have a treasure chest. Kids always remember our treasure chest. So yeah, I think just being, kind and approachable makes them comfortable.
You talked about your dental school and residency training, about being in NYU, how you develop connections and all, but especially given that this is a very hands-on oriented field, we wanted to ask at what point, or what's the learning curve that you're taken through with training in getting up to that point where you are dealing with actual patients? So do you first start out with models at some point in dental school, and then do you go on to real patients in residency, or are you able to deal with real patients in dental school? Can you just take us through the learning curve?
Sure. So when I was looking for dental schools, it was really important to me to find a dental school that had early clinical experience. What I mean by that is they place you in the clinic seeing patients as early as possible. So your first year of dental school, you're pretty much in the lab. So meaning you're working on mannequins and you're doing wax ups, you're making models, you're learning how to use a drill, you're learning how to use all the instruments, really, everything, and just getting oriented. You're learning the basics. Your second year, you are getting a little more advanced in your restorative technique. So you're learning how to do like crowns and bridges, whereas in the first year you're doing like fillings basically. And then at the same time, there's a lot going on at once in dental school. It's not like you're like just in the lab and just in class. You're also in all these like mini like simulation courses where you're doing cleanings on each other or learning how to give local anesthesia to each other. So there's like constantly little things that are happening along the way that are building you up and getting you more comfortable in the clinic. You also start shadowing in the clinic your second year, because in the third year at NYU, I don't know if things have changed since I left, but in the third year is when you like officially enter the clinic with like a full book of patients, and you're there like, 2-3 days a week or whatever it is, full days, or 5 days, half days, I forget, don't quote me on the exact schedule, but third year was when you're like officially in the clinic. And then fourth year, you're also full-time in the clinic. So second year, you're kind of in and out, shadowing a little bit, doing these simulation classes, working on classmates maybe, or helping out the third year in the clinic, like assisting them. So you're chair side with the patients, but you're not the one actually doing anything. You're like a little more hands off, but still there learning it. And even through fourth year, there's still lab courses that you're taking. So you're getting more and more advanced constantly. So like, your fourth year, maybe you're taking like an advanced aesthetics lab course or something, that's helping you just like strengthen your clinical skills, because you're always getting better every day, even after dental school and residency. You're always picking up new clinical skills. It never really ends. So even CE courses now, I'm required to take advanced continuing education courses, and like some of them include mannequins. So it never really ends. And then in residency, though, you're mostly just working in the clinic with patients. In the beginning, for us at NYU at least, we did have like a month of some lab classes where we really honed in our technique on pediatric specific restorative treatments. So like doing silver crowns is not something that you do on permanent teeth. So like, honing that skill, and doing fillings on a baby tooth is very different than doing fillings on a permanent tooth. So also working on that. But then after that, it's just like you're in the clinic all day, really treating patients.
Talked about the differences between multi-specialty and Medicaid offices. In residency, is it catered towards practicing in one or the other? I know you mentioned things like higher volume in one and the other, different rates of reimbursement and all. So with residency training, does it vary from program to program in terms of how they cater towards one setting or the other, or is it general?
No, I think it's probably a broad experience. You'd be well prepared to kind of practice anywhere, but the nature of the hospital is probably more similar. The patient population is more similar to a Medicaid office, but that doesn't mean your training is any different. For example, like in a Medicaid office, you're seeing 30 patients a day, and maybe in residency, you're only seeing, maybe like, I don't know, 12 for me at least max at the hospital. So you do have all that extra time. So you're still doing all that stuff yourself. Whereas in a Medicaid office, a lot of times things are divvied up, like responsibilities are divvied up. So like you're not going to do the cleaning. You're just going to go in and do the checkup at the end. Whereas in residency, you do everything yourself. So you still get the training to do all that.
I know you talked a lot about pediatric dentistry, but were there any other specialties that you were considering along the way?
No, I knew it was for me. When you interview for dental school, they tell you like you shouldn't admit that you know what you want to do and if you want to specialize. I think it depends on the dental school. Also, some dental schools like kind of push out more general dentists. Some dental schools push out more specialists. But I was always honest about it. But had an open mind, so whenever they ask me like, oh, do you want to specialize? I'd say, yeah, but I'm looking at everything. I'm open to everything, but I wasn't. I knew I wanted to do pediatrics.
When you're doing any procedures, especially ones that, there's not necessarily, a special procedure that I would refer to with this, but in general, I wanted to ask about any concerns that you might have for airways with procedures. Are there any protocol behind that if there are concerns?
Yeah, so airway is a very broad topic. We always assess airway because it's a part of like that's just their body, right? So before I answer your question, just like in general, snoring and sleep apnea, like things like that, grinding habits, those are all important in our discussion with the patient. And there are ways that we can correct that by working with an orthodontist usually, or some pediatric dentists do it themselves. I have an orthodontist in my office, so I just kind of utilize her. But I'll see the patients, I'll screen them, I'll bring them in and then refer them to her. Or there's certain things that we can do, like tongue tie releases or lip, that are going to change the anatomy of their mouth basically altogether. And then also change their airway too, or refer to an ENT. It's a lot of multidisciplinary care, work with speech pathologists as well. So airway is very broad, but then in terms of like protecting the airway, if that's what you're asking, there are certain things that we do. Like if we're doing an extraction, I always put a throat screen, like a piece of gauze there before we do the extraction to prevent things from falling down. But treating their airway is definitely like a part of what we do.
We had an earlier session with Dr. Hobbs over another specialty. She talked a lot about laser surgery within dentistry. Do you also incorporate that into your practice?
So I personally do not. Some pediatric dentists do. I'd say the majority don't at this point. I'm sure like in the future, in the next couple of years, it will change. The only like relationship I have to a laser at this point is for tongue tie releases and lip tie releases. I don't like do any actual like fillings or anything with lasers, which some people do. But you never know. Ask me in 5 years, maybe it'll change.
With anesthesia, like just any local anesthesia or general anesthesia that you've administered, have you seen any patients have any adverse or bad reactions to that within your time in practicing, and how do you deal with it?
No. So fortunately, you know, I work with a pediatric anesthesiologist when we have to administer general anesthesia. So he's the one that's administering it and then making sure that they're recovering from it. So if there are complications, sometimes I don't even know about it. I don't get involved, which is better for me. When we did oral sedations in residency, we were the ones that were administering it and monitoring the patients and making sure they recovered okay. Sometimes we see like adverse reactions in the sense that like the kids kind of it's supposed to like keep them in a lull and it makes them react like crazy basically. So sometimes we'll see that, pretty rarely. And then in terms of like allergies or anything like that, we ask a lot of questions to make sure that there aren't any red flags for anything that we're giving them. So, like any history of surgery in the family, we ask like, have mom or dad had surgery and then gone under general anesthesia for anything, or twilight anesthesia, anything, and any reactions to that. We ask them a lot of different questions that would then hopefully screen out those issues. And then in terms of local anesthesia, it's very specific for kids. We calculate their max dose that we're allowed to give them. And I'm just very careful not to ever go above that. So I think as long as you're aware of and it's the same for all anesthesia. There's always a max for everything that you give. But that's like the one thing that I'm really administering day to day. So I'm always aware of their max dose. I just make sure I don't go over it. And then hopefully they don't have any, reaction to it. But a lot of times kids bite their lips, which has nothing to do with how much we gave. It just, adults do it too. But yeah, they bite their lips, and then that's worse than the whole process of coming in for a filling or whatever they had to come in for in the beginning. But it happens.
Earlier on, when you're talking about your journey, you're talking about dental outreach. It's not something that we often hear as much as we do about standardized tests, grades, coursework, research. But with that said, when you are entering that kind of atmosphere, going to a different country, helping out in these pop-up clinics, what kind of, not sure what the right word would be for it, but what kind of approach would you take in trying to learn the most that you can? Would you write down any notes at the end of the day? Would you try to ask questions here and there? how can students extract the most from experiences like that?
Yeah, I think you're constantly learning the whole time. You know, I remember on one of the outreaches I went on, it was just alphabetical, our seating, and I sat next to an endodontic resident, so someone who specializes in root canals. And I spent the whole time just like chatting with her about life, but like, I picked up little pearls here and there about like applying for residency or like life after dental school, things like that. You're just around a lot of people that you wouldn't normally be around, and so you pick up stuff as you speak to them. And then while you're in the clinic, of course, you're doing dentistry at a faster pace than you're used to in the clinic at dental school. So you're learning just as you go, and there's faculty that are right there, right behind you, holding your hand with you with the drill and like guiding you on how to move faster. Like I remember something that I learned in one of my outreaches that I never picked up in dental school was like, never take your foot off the pedal, like always keep going, like don't stop, don't pause, don't second guess yourself, keep going, you don't have time, you got to get done. And that was like such a valuable lesson that I learned, like just don't stop, you got this, you're fine, like keep drilling, whereas like as a very hesitant third year dental student, I was like constantly pushing my foot on the pedal, taking it off, pushing it on, taking it off, spraying air and water, checking to make sure everything looked perfect, and it wasn't perfect, you know what I mean? I was a third year dental student, but like just go. So, just having that guidance, that one-on-one guidance, and being in a faster paced environment, you just naturally are going to pick up as you go. And then we would always like debrief at the end of the day. So we'd have conversations with each other on like what worked that day or didn't work that day, or things like that. So I can't say I'm like such a note taker in those sorts of environments. Obviously in class I took notes, but when you're just learning on the go, I think stuff just absorbs in.
We always like to ask, and this is a question that's pretty general to really any specialty involved. I like to ask, how can students get involved, particularly with pediatric dentistry? So I know there's positions like being a dental hygienist or a dental assistant that gives you, just like you mentioned, experience where you can absorb it in the moment when you're on the go. Would you recommend other positions outside of that? And again, how do you think that they can extract the experiences best outside of, or would it just be the same approach outside of what you already mentioned?
Yeah, I think if you're looking to go to dental school, you have to shadow anyway to get into dental school. And I think unfortunately that's the closest you're gonna get to like, anything. You don't really like know until you do it yourself. But in that sense, you'll just like take the first check mark and be done, which is like, okay, like this, I could spend every day for the rest of my life doing this, which is like the most important thing at that stage in the game. I don't think you should worry so much about like your technique on giving local anesthesia. You know what I mean? That's something you will get later. The most important thing is just like one step at a time and like, okay, let me shadow in a dental office. Let me make sure I like this. Let me make sure I like this environment. Let me make sure I could work in a private practice like this or a hospital setting or something similar. And if yes, then that's great. You're on the right path. And like the next thing will come when it needs to come. But as far as getting involved, I'd say just shadowing.
One student asks about, similar to what you mentioned in being a third year student, trying to make sure everything is perfect. How do you get over that fear of potentially making a mistake with a patient and building the confidence you need to be a good dentist?
Oh, you're going to make mistakes. So you're going to continuously make mistakes. I think what's actually important is to learn how to acknowledge your mistakes and your fears and to overcome them, like by being real with yourself. Like, I think saying, like, oh my God, I'm so nervous and like I'm, you know, doing this wrong or whatever, I feel uncomfortable. And like, the most important thing is having also good mentors around you. So like that faculty that told me like keep your foot on the pedal, like going to a school where you feel like I'm gonna fit in here, or I'm gonna get good guidance here, or I'm gonna, make good friends here who are gonna help me. Because in dental school you live off of your friends. Like, everything is, it's like you at least at NYU, it's like you versus them, and them being like the institution. So I think surrounding yourself with good mentors and friends and faculty is really important in that, and like just learning how to take feedback and learning how to handle what happens when you make mistakes or you screw up. I remember one time in residency, I was so nervous, I numbed the patient on the wrong side of their mouth to go do a filling. And like, you just have to own up to it. And you have to be honest, and you tell your faculty, and then they help you figure out what to do. The worst thing to do is to make a mistake and like act like it's somebody else's fault, or, not acknowledge it or something like that. And then I think I answered the question, right?
Yeah, you definitely did. We do have one more question, and then we'll wrap up the end of the hour. Again, thank you so much for answering all these questions. The last we'll go through is about, again, being a very hands-on field. There's dexterity that's involved with that. Do you have any hobbies or practices early on that you utilize to maintain that?
I always loved working with my hands. I can't say I like necessarily had like one specific hobby or like skill that I'm really, really good at. Like, it's always been little things like, well, in college, of course, to get into dental school, you have to demonstrate dexterity. So like I took a ceramics class, which I ended up loving. And then I took like a second, it like led me into taking more art classes, which I didn't even expect. Like, I don't think I'm like there are some dentists who are very artsy and like go into things like aesthetics because they have such an amazing eye and all that. Like, I enjoy working with my hands. I don't think I'm like the most artistic person or like artistically gifted person there is. But I was always very good at like untying necklaces when they got tangled. I know that sounds very silly, but like I loved like fine motor skills. I always did really well with that. And like, I always did really well with like on the DAT, you have to, there's like I forget the name of the section, but it's like I don't know. You guys will know better than I will at this point. I've forgotten everything, but there's a section where they give you like a printout of like a box, and you have to like fold it up mentally and like imagine what it would look like. Like, you have to understand like 3D imagery without it being 3D, because like you're looking at x-rays that are two-dimensional and you have to imagine it's actually the tooth. Like, you have to see things upside down when you're working on the top part of the mouth. Like, there's all these like weird, you just have to have good hand skills. And like, I felt like I was always really good at like visualizing things in my head. And yeah, like I said, like picking knots out of necklaces or like tying knots or shoelaces or like weird little things like that. But I'm definitely not a skilled piano or violinist or anything like that, if that's what you were getting at. And you don't have to be a dentist.
Yeah, I think sometimes, just in the same way that some people are intimidated or just built up anxiety with approaching a patient at first, the mistakes that they might potentially make, it's all really overthinking it, I think. Having the confidence boosts the performance in the end. I think that's all the questions we have for today. Again, thank you so much, Dr. Kaplan, for joining us. I do have a few last reminders for those who are joining us. Again, if you are new and are wondering how you can earn credit for your attendance, to do so, you must pass the quiz to receive a certificate. That quiz is now posted in the chat box, and it's also available on our website under the virtual shadowing page. The quiz will be due at 11:59 p.m. Central Standard Time this upcoming Sunday, July 31st. It's usually, in general, whether it's a Monday or a Thursday or any other day in the week that we have that shadowing session scheduled. It's going to be around 6 days at 11:59 p.m. Central Standard Time from that session that it will be due. After passing that quiz, you will receive a certificate, which will be sent to the inbox of the email address that you list on the quiz. To pass, you need a 60% or higher. And in case you don't find your certificate in your inbox, please let us know or check your spam folder just in case. For our next shouting session this week, later on Thursday, we're going to be joined by Miss Jordan. Again, Thursday, July 28th at 7 p.m. Central. And for those who want to stay tuned, like I mentioned in the beginning, follow us on Instagram, and that's where we post our flyers. Also, our listserv is a great option. Other than that, Dr. Kaplan already provided her email and her Instagram handle. So if you want to get connected, feel free. Again, thank you so much, Dr. Kaplan. We really enjoy your presentation and appreciate your time.
Of course. Thank you for having me.